This is a simulated patient task assessing information gathering, communication with patient, communication with colleagues, patient safety, and applied clinical knowledge. You are in the gynae clinic today. You are going to see Natalie Wells, an 11-year-old girl with her mother. Her mother wants to discuss about HPV vaccine as she hasn't decided whether she will give it to her or no. Please answer the questions and address her concerns. So we will start as usual by introduction. So introduce yourself by name and role, confirm the aim of consultation, take a rapid history. We usually don't expect anything odd in her history. She's a young girl and she's just coming for counseling. So first of all, when we are going to explain about it, so we need to tell her what's HPV. So it is human papilloma virus, and this term doesn't belong to one virus. It's a group, a big group of viruses which can contain up to 100 types. Okay, and they are very different in terms of virulence, in terms of the risks, in terms of the disease they cause. So some of them may be very low risk that can be asymptomatic at all, causing no harm, and the immune system can simply get rid of them without needing any treatment. Some of them can be low risk, but can cause diseases and can be transmitted, like, you know, the viruses that cause warts, sometimes genital warts or any warts in other areas of the body. And the high risk group, which can cause cervical cancer, vaginal cancer, and sometimes vulval cancer as well. Okay, so there are many varieties and serotypes of human papilloma virus. The most important thing we need to tell the patient's mother and considered as a safety point or patient safety issue is, since we are giving the vaccine that protect the girl against having this infection, but it will not protect her from having infected by all the types of the virus. It has to protect her against the common and the high risk viruses and the common low risk viruses. But there are many types who are not included in this vaccine. And that's why even if she received the full immunization, like 2 doses or 3 doses, according at what age she will take it, then she will need as well to have her cervical screening as usual, starting from 25 years. So even if she is vaccinated, she will have her smear tests done as usual. So what is the type of the vaccine giving now in UK is Gardasil 9. Why it is called Gardasil 9? Previously it was Gardasil, but now it is replaced by what we called Gardasil 9 because it's now protecting against 9 types of viruses instead of 4. Okay, so it's now protecting against 9 types of viruses. This includes the viruses that can cause cancer in the vulva, vagina, cervix, some cancers in the head and neck, some cancers in the anogenital area, and also the viruses that can cause genital warts. Okay? So the vaccine is nowadays given to both girls and boys at the age between 12 to 13 years. And this is equivalent to year 8 in the school in UK. Okay, so it is considered apart from the NHS immunization program, but they can't give the vaccine to the girl or to the boy without a parent consent. Okay, so that's why some parents doesn't know about don't know about the vaccine pros and cons, and then they will be reluctant to sign the consent form, or they may come and discuss this issue. Okay, so usually if it is given on that time, the person will need 2 doses for achieving full protection. Okay, so the first dose can be taken in year 8, like around 12 years and or 13 years, and the second dose can be given um, on 6-month interval, or it can be up to 24 months interval. So sometimes they give it next year or next after, like, 2 years. So we can have it from 6 months to 24 months from the first dose. Okay, um, the mother may ask about what can be the side effects of this vaccine. There is no known side effects of the vaccine. Actually, it can be like some general manifestations, like any other vaccine, some tenderness at the injection site, redness, and general manifestation like feeling unwell for a day with some bone aches, and then the girl will recover the second day with some. She can take paracetamol and have rest on the same day of injection. Okay. What if she missed her vaccine date in the school, and she decided later on to get it? Will she be able to get it? Yes, she can go to her GP or to notify her school again that she needs to take the vaccine, and she can have it for free until her 25 years of age. So until she completed 25 years, she can have it for free. Okay? So the mother will ask, like, why I need to give her at this age, and she's not sexually active yet, and we don't expect that she will have multiple partners or like that. So the answer will be that this vaccine works better in the young age rather than in the elder age, and it works the best in this specific age between 12 to 13, 14 years of age. So if the girl is willing to take the vaccine at this age, she will need 2 doses only. But if she took it like after she completed her 15 years, she will need 3 doses instead. So 3 doses will be 1 dose like today, for example, and the second dose will be in a month's time, and the third dose in 3 months' time from the first dose. Okay? Um, so the mother can ask about, what about other sexually transmitted infection? Will that prevent other sexually transmitted infection? No, it will not prevent other sexually transmitted infection. This vaccine is only directed to the human papilloma virus type of vaccine, and the benefit from that is to reduce her risk to develop uh, cancer cervix, or to develop any problems like genital warts in future. And we found that the vaccinated people have a very low rate of infection and transmission of this virus. Okay. When she told that her daughter is not expecting to have sexual activity, uh, we can tell that we understand well what you are telling. However, this virus is very, very, very common, and it can be transmitted by any kind of skin-to-skin contact. So if this virus is found in the fingers, if this virus is found in the mouth, if this virus is found in any skin area of the body, it can be transmitted easily to the genital area with the touch, with any kind of contact. So it's not necessarily she will have, a kind of sexual activity, a proper sexual activity. But if she has any kind of skin to skin contact, she may carry the virus, and she may take it, or being infected if she gets in contact with some infection from infected skin. That's why if we give it in a younger age, it will act better, and also it will protect her from catching infection by any of these skin-to-skin contact. Okay. Since it's not protecting for other sexually transmitted infections, then we will advise her also to still use safe sex practice. If she can use a condom all the time to prevent sexually transmitted infection, that will be great. Okay, so there is no more information about it. So it's just to confirm that there are minimal side effects. The benefit is to protect against these high risk viruses, so that we can protect her from developing cancer. Also, we need to stress on that even if she is vaccinated, she needs her cervical screening to be done as usual.